We talked about Vasculaze as the follow-up to these vascular beds, right? So you're treating red, rosy cheeks, and then you have those pesky little vessels. This is now where you take your Vasculaze out and spot treat. You could also treat little spider veins. You could treat vascular malformations like angiomas. What you can't treat is varicosities. Cannot, N-O-T, you cannot treat varicosities. That's an upstream problem, needs to go see your vascular friend. So if you have large varicose veins, this is not appropriate treatment for those. But vascular malformations like little angiomas, little spider veins, this is great, great, great for those. There's no consumables on this one. There's no consumables on your IPL. Very important to note. So once you buy this, it's yours. Doesn't cost you anything except staff time and ultrasound gel to run this. Now, Morpheus, there is a consumable. It's the tip because I'm sticking a needle inside of you. It wouldn't be appropriate for me to then go do that on another patient. But these were just on the surface. So no consumables for your IPL, no consumables for your Vasculaze, and no consumables for that forma we just talked about. So vascular malformations, you see spider veins like crazy. It's important to note, this is 9 months later. Stable after 9 months. You can see our settings and our fluence and the number of passes. This is what it looks like immediately after. I popped this, we test spotted it because the patient was worried that it wouldn't work. So whenever someone does that, say, hey, just come in, let's test spot it. So she didn't think it would work because she already had a failed sclerosis or a sclerosis, and I can't remember her story, but she was telling, hey, this probably won't work. I said, well, let's just test spot it. So this is before, this is immediately after I kind of boxed the air. I just popped twice, pop, pop, and I'm sorry, I forgot to get her picture and follow-up, but it totally cleared in this square. We totally forgot to load that picture next. So then we went on and treated the remainder. This is not a butt cheek. This is my nurse practitioner, and every time I show this picture, she's like, please tell them that this is the inside of a knee, and I'm going like this, and she took a picture like this. But it's funny how that literally could be a leg and a right butt cheek, but it's not. So this is my nurse practitioner treating herself with clearance, and then on her ankle, it's immediate. That's a normal immediate after. And this is some foundational studies that we use to get the percent change and the durations. So this is very, very stable over time. When you follow up out to a year, we see resolution out to a year. It is common, though, to educate your patients for maintenance treatments because likely whatever they're doing to have caused these little spider veins, they are still doing, like crossing your legs. My 15-year-old daughter tells me you're not supposed to cross your legs at your knees because that's what gives you those ugly veins that mom doesn't like. You're supposed to cross them at your ankles is what she tells me. So I don't know if that's true. I don't have any literature to support that, but that's from my 15-year-old. She's now, oh my gosh, that is a bad miss. She's 17. 15 is what just came out. She's 17. My son is 15. Yeah, she would have killed me. My 17-year-old tells me this.